right from the beginning, some people here taught me not to do conversations with patients the usual psychiatric way. There were two old colleagues of me here, Dr. Konstantin Hamamjiev and Dr. Strashimir Ivanov, who were leading the conversation in very, very much the solution-focused way, without ever saying something about it, without ever describing it or teaching to others. But I have seen them leading the conversation in ways that the client wants to go, and almost totally uninterested in talking, describing symptoms, hallucinations, delusions, things like that. And when I noticed this right from the start, I was very, very intrigued. And they were the first people to tell me that the more you talk about something, the bigger it grows. So when I happened to meet solution-focused brief therapy through Dr. Anton Karshutsky, who was a Bulgarian psychiatrist working in Sweden, you probably know him, I just knew I had no other way. For me, in a way, it was not a matter of choice. Simply because these colleagues of mine, whom I respected very much, were doing this simply because their clients, their patients, had taught them to do it this way. They learned this through their clinical experience. And they had already told me a lot about it. And it was not one person, it was two of them. So when I read the first book about this by Steve DeShazer and Putting Difference to Work, I knew that this is the way to go, and no other way for me.
So you recognized it from your practice and from your mentors, and then you saw the book and you know that it's the same thing, or it's in the same tradition.
Yeah, exactly the same.
Okay. So you started to use the solution-focused model in Bulgaria.
Yes.
When was this? Where are we now in time?
1992. Dr. Karshutsky came here. He did a couple of trainings, and then I met Steve DeShazer in Prague at the Institute for Systemic Experience, and then he invited me to Milwaukee for the last course, extensive course they did in Milwaukee, and that's how it happened in 1994.